Good day, class. So we are on the second part of your immunodeficiency diseases. On the first video lecture, you were able to cover and I was able to discuss the B cell system deficiencies. And as I emphasized in the previous video lecture, that the B cell system deficiencies or immunodeficiencies involve more on the humoral part. Okay, specifically that your B cell will mature to your plasma cells that will use your antibodies. And then for your immunodeficiency, specifically with the cellular immunity class, is I'll discuss more on the T cell. And I was also able to discuss in a previous video lecture that your T cell can influence, correct? That your T cell influence your B cell maturation. So again, even like in this video lecture class, there are some part of diseases presented here with a combined. Ibig sabihin ng combined class is that not only the T cell, okay, but also your B cell is affected. Okay, so defect in cell-mediated immunity can result from abnormalities at many different stages of your T cell development. Okay, so if you will try to compare your T cell and your B cell, okay, maturation, the strictness of your positive and negative selection is more on the thymus compared with your uh, bone marrow. Okay, however, the affinity and avidity checking is the same. Okay, so it means class that your bone marrow and your thymus perform the same level of strictness in terms of your affinity and you have your avidity. And then many different molecular defect can result in a similar clinical picture, okay, as in severe combined immunodeficiency or SID. And I'll try to discuss the pathophysiology of your SID later. Okay, this is because your T cell, okay, provide helper functions that are necessary for your normal B cell development and differentiation. Okay, so now we can appreciate the T cell class if we think of with their B cell. Kasi the B cell will not mature without the help of your T cells. Okay, so now you need to find your own T cell class. Okay, if you are a B cell, okay, developing to become a plasma cell, because at the end of the day, diba, our primary goal is to produce antibodies, okay, that will try to opsonize those problems and then engulfed by your macrophages in your life. So either your friends will try to help that one and etc. Okay, so what I what why I always give a life scenario class in order for us to retain the learning. Hindi ko naman sinasabi kung ano yung example ko, yun din yung example ninyo. Make your own story. Okay? Because immunology is a beautiful movie class. Ang director kayo. Okay? So you need to create your own scenario for you to completely understand your immunology. Okay? And ayun, so let's move here. These are the diseases, okay, mentioned by Stevens, okay, on your table 16-2. And then we will discuss them individually. And we'll start with your DiGeorge anomaly. Okay, with your sorry pala class. Excited ako. Okay, so before we'll try to dig in with the diseases, okay, so the defect in cellular immunity are more difficult to manage than defect in the humoral immunity. Yan, diba? So, we need to ask ourselves why. Bakit kaya mas mahirap i-manage ang mga T-cell or cellular immunity na mga defect compared with the humoral part? Tingin nyo, class, bakit siya mahirap? Tama, class, correct. 'Di ba? Kasi, as I mentioned in the previous video lecture, in the treatment, we can easily give, okay, an or intravenous, 'di ba, na mga antibodies for the patient. However, in your T cell or cellular immunity defect, we cannot, okay, give for example, soluble product kasi wala namang soluble product deficiencies na nagaganap sa mga cellular immunity. So more or less, the treatment is either bone marrow or replacement or correction with the genes. Okay, so that's why your cellular immunity deficiencies are more difficult to manage compared with your humoral part, which is your B cell system. So let's start with your G-George system. So if you can observe on this slide class, dalawa yung nilagay ko. Okay, kasi di ba ito apat to class. Pakita ko ha. 1, 2, 3, 4, 5, diba? 5 na mga conditions. Sa 5 na mga conditions class, dalawa lang doon ang individual. The rest are combined. So, ibig sabihin ng combined is that meron siyang both KT cells and B cells. Okay? So, we'll start with your DiGeorge anomaly. Okay, so this is your DiGeorge syndrome. Okay, DiGeorge anomaly is a developmental abnormality of the third and fourth pharyngeal pouches that affect thymic development. I know that you'll be having difficulty imagining this one class kasi even like in our anatomy and physiology, the specific part of your pharynx are not well explained. So even like me, I just learned this one when I took my master's, and then I took also my doctorate in medicine here. Okay, because we are also concerned more on the autoimmune and immunodeficiency as my specialization. So when I tried to make this PowerPoint in video lecture, I was like thinking it would be very difficult for the student to understand. Okay, kung ano yung location. So here, I found a good picture class. This is your pharynx. Okay? In your pharynx class, okay, meron tayong tinatawag na mga pouches. Okay, we have 1, 2, 3, 4 pouches. And in between your pouch number 3 and pouch number 4, this is your thymus is located. Yan, di ba? Makita niyo class, eto, okay, may pouch siya, doon nakalagay si thymus mo. So, according kay Stevens class, if there is a abnormality of the third and then the fourth, pharyngeal pouches, this will affect the development of your thymus. Either your thymus will become small, or hypoplasia. Kaya here class, this is associated with abnormalities, that includes mental retardation, absence of ossification of the hyoid bone. Ito yan sa class anatomy. This one. Okay, that will support your jaw. Okay, that is your hyoid bone. Cardiac anomalies. Okay, because of your parathyroid, and then your thymic hypoplasia. So if you can observe with your DiGeorge syndrome, this is not only isolated to immuno problem. Okay, so for example, you have your cardiac anomalies, you have your mental retardation, you have your abnormal facial development. This could also be explained in your clinical chemistry, specifically your endocrinology class. Okay, so I hope that you appreciate this one. So at least meron na tayong visualization kung ano yung pinagsasabi ni Stevens class. Ayun daw. Pag ano daw, may problema sa pouch 3 mo at saka pouch 4, then na-affected si thymus. Bakit? Kasi nasa gitna si thymus class. Okay? So nagkakaroon tayo ng thymic hypoplasia. So sir, anong ibig sabihin pala ng thymic hypoplasia? Kasi hindi ko din maintindihan yan. Okay, so pag sinabi nating thymic hypoplasia class, you have here, thymic, ibig sabihin thymus, and then hypo, ibig sabihin decrease, and then plasia, ibig sabihin development. So ibig sabihin class, nagkakaroon ng underdevelopment yung thymic mo. Bakit? Kasi baka masikip or may abnormality sa third and fourth pouch ng pharynx mo. So, pag nagkakaroon tayo ng underdeveloped na thymus, then therefore, class, the number of your T cell is also affected. Tama? So, kung affected sila, here, the quantity, sabi pa ni Stevens class, the quantity defect in the thymocytes. Kulang class. Okay, so kulang tayo ng ano, lymphocytes, okay, or not enough class, okay? And then, not enough mature T cells are made, but those that are present are functionally normal. So, ibig sabihin, class, hindi naman like totally depress yung number ng lymphocytes natin. Kukonti lang yung na-produce. Pero yung kukonting na-produce doon, class, those are still functional or normal. Okay? Sorry, class, I apologize. Okay. Okay, because my charger is unplugged, so I fixing it. Ayun, so you have your thymic hypoplasia, class. Okay? And then next, o yun, so tapos na tayo, ang bilis, di ba? So we're done with your DiGeorge syndrome. Madali lang yung palatandaan natin sa DiGeorge syndrome classes. Meron siyang problem with the third and fourth pouch, then causing the size of your thymus decrease, kaya nagkakaroon tayo ng decreased number of your lymphocytes. So next, you have your purine nucleoside phosphorylase or PNP deficiency. So the number of your T cell progressively decreases. So ibig sabihin, class, your thymus is okay. Walang problem. Okay, so walang DiGeorge syndrome kasi normal yung ano natin, class, normal yung third and fourth na pouches natin. So pag normal ang thymus, walang thymic hypoplasia. And then, ibig sabihin, class, hindi siya DiGeorge syndrome. Pero nagkakaroon tayo ng decrease na number of your lymphocytes. So, now we can consider your PNP deficiency. Kasi ang nangyayari dito, class, may decrease na lymphocytes in the circulation because of the accumulation of your deoxyguanosine triphosphate, which is a toxic purine metabolism. So if you can observe here, but this is more on the clinical chemistry class, specifically with synthesis of your uric acid. Pero, i-slightly discuss ko siya in immunologic way. Okay, so here, if you can observe, you have your ano class, hypoxanthine and guanine, right? And then, in order for the hypoxanthine and guanine to produce, kailangan natin ng PNP. You have your purine nucleoside phosphorylase, an enzyme that will try to convert this product to guanine and hypoxanthine. So, siyempre, pag hypoxanthine yung product mo, you have your xanthine oxidase. Okay, that will try to convert your hypoxanthine to xanthine, and then an enzyme called your xanthine oxidase to your uric acid. The same pathway if you have your guanine. However, the different enzyme is used, you have your guanines. However, class, pag wala daw tayong PNP or purine nucleoside phosphorylase, ito yung function niya, diba? So, ang nangyayari, class, si guanosine at saka si dioxyguanine, class, hindi nako-convert to guanine form. Kung hindi sila nako-convert to guanine form, class, ang mangyayari, this one will be degraded, and then meron tayong accumulation of your GTP and DGDP. Tapos, kung meron tayong accumulation of this one, class, these are toxic with your lymphocytes, okay? Kung toxic sila sa lymphocytes, pinapatay nila yung T cells, kaya meron tayong decreased number of your lymphocytes. Okay? Not because of the thymus na problem, but because of the accumulation of your toxic purine metabolism. Then it produces a moderate to severe defect in cell-mediated immunity. Kasi it depends on kung gaano kadami yung accumulation ng ano natin, purine metabolites. Okay, with normal or only mildly impaired humoral immunity. Okay, then recurrent or chronic pulmonary infections, oral or cutaneous candidiasis, diarrhea, skin infection, urinary tract infections. If you can try to read the entire chapter class of your immunodeficiency diseases, ito yung paulit-ulit. Okay? Kasi the function of your cell-mediated and your humoral is fighting against these infections. Okay, so we're able to discuss your DiGeorge okay, syndrome, and then you have your PNP deficiency. So we'll move to the condition where your T cell and your B cell is involved. And we call that one SEED class. Okay, SEED stand for your severe combined immunodeficiency or SEED. Okay, ito yung pinaka most serious among the congenital immune deficiencies that we have. And sadly, okay, it is a X-linked seed, which is the most common to it means class na ang affected are males. Yan. Okay, so I don't know if you're familiar with David Vitter. Okay, so he was coined as the bubble boy, and then I still remember class when I was on college. In college, uh, our immunology professor give us a uh, tawag nito movie uh, class discussion kasi merong the Bubble Boy na movie pertaining with David Vetter. He survive up to 12 years old class. So, meron siyang seed. So, ibig sabihin class, bakit siya nilagay sa bubble? Kasi pag na-expose siya sa environment, kay wala siyang T cell and B cell to fight against external infectious agents, then possible na magkaroon siya ng severe infection leading to death. So, the question is, what is the problem with your seed? Okay, the abnormal gene involved codes for the protein chain called the common gamma chain class. Okay, common gamma chain, which is common to receptor for interleukin 2, 4, 7, 9, 15, and 21 class. Okay, so I know that you are having difficulty understanding this one kasi first, we were not still able to discuss your cytokine. Second, is that this is too deep. However, we need to understand the basic. Okay, so with this one, I would like to explain in a simplest way. Okay, kung ano yung common gamma chain. So with the common gamma chain of your cytokines class, this one is a good example. So we have receptors. Okay, receptors for interleukin 2, receptor for interleukin 4, receptor for interleukin 7, receptor for interleukin 9, receptor for your interleukin 15, and receptor for interleukin 21. So, if, for example, your body will release a specific cytokines, and then, pupunta sila dito sa specific receptor nila. So bakit sir tinawag silang common gamma chain receptor family? So tinawag silang common gamma chain class because these receptors have gamma chain on their receptor. Like for example, the interleukin 2 receptor, meron siyang alpha chain, beta chain, gamma chain. Interleukin 4, meron siyang alpha gamma. Interleukin 7, alpha gamma. Interleukin 9, alpha gamma. Interleukin 15, alpha beta gamma. Interleukin 21, alpha and gamma. So ibig sabihin class, nakalagay dito, here, okay, pag meron daw abnormalities of the gene involved in the common gamma chain class. So, ibig sabihin yan, kahit may production of your interleukin 2, pero walang gamma, okay, na chain, then therefore, walang signal na mangyayari. Okay? So, normal signaling cannot occur in cells with defective receptor, thus halting natural maturation. Para mas maintindihan ninyo, class, yan, naglagay ako ng picture here. Diba? Ito yung T-cell ontogeny. So, meron tayong hematopoietic cell, tapos you have your lymphoid progenitor cell. Tapos sa lymphoid progenitor cell mo, magde-decide siya kung meron siyang affinity to c-kit o wala. Kung wala siyang affinity to c-kit, pupunta siya sa thymus, tapos magkakaroon na tayo ng precursor cell. Tapos yung precursor cell mo, class, okay, so mag-ano man yan sila, dapat divided into two. Either they will proceed to NK cell or become a mature T cell. Tapos, the maturation class of these two, take note, the maturation of these two requires interleukin 7 and interleukin 15. So this is your interleukin 15 and interleukin 7. Pero ang problema daw class, meron tayong interleukin-7 at saka interleukin-15. Ang problema kay SEED, wala siyang gamma chain or abnormal yung gamma chain niya. So kahit na daghan kaayo na class, so kahit na madami masyado yung ano mo class, interleukin-7 at saka interleukin-15, if your receptor is not functioning, then therefore walang ma-produce na NK cell at saka mature T cell. Kaya if the SEED patient, meron tayong tinatawag na phenotype number 1, you have your T cell negative kasi wala siyang mature T cell. B cell is not affected kaya meron siyang B positive, that's B cell positive. Pwede din siyang NK positive cell class if merong makalusot, for example here, and then or ET cell negative, B positive, and NK negative phenotype. Okay? Take note. Okay, well, that's one. Kasi with the seed, meron tayong isang factor that will cause the condition. First is the mutation on the common gamma chain. Okay? Second class is here, walang problema sa ano, gamma chain. Kasi kung may problema sa gamma chain, ang tawag doon class X-linked seed. Here. Pero may mga chances class na walang problema sa gamma chain. Ang tawag natin dyan class is autosomal recessive form of your seed. So either male or female is affected. So ibig sabihin yan class, pag meron tayong autosomal recessive form of seed, walang problema sa gamma. So sir, kung walang problema sa gamma, ang ibig sabihin ba niyan, sir, the interleukin can bind to the interleukin receptor? Correct class. Yes, nakakabind sila. So sir, so ano ang problema? Kung yung gamma chain pala natin, sir, is okay, tapos the cytokines will bind to the interleukin will bind to the interleukin receptor. So ano yung problema, sir? Yung problema naman class is under your JAK-STAT pathway. Okay? So the lack of your intracellular kinase or JAK3 means that the lymphocyte are unable to transmit signal from interleukin 2 and interleukin 4. So meron ka nga interleukin 2, meron ka ding interleukin 4, okay, tapos meron kang gamma. However, the JAK-STAT pathway will not be activated. Okay? So these patients have ET negative, T cell negative, and then B positive, B cell positive, and NK negative. Tapos, add ko na lang din class that your JAK3 gene is located on chromosome 19 and then region P12. And then I know that you will be having a difficulty understanding kung ano yung function ni JAK class. Okay? At saka sino si JAK. JAK is the abbreviation class of Janus kinase system. So meron tayong tinatawag na JAK-STAT pathway. Okay? So I am very familiar with this one because my dissertation with my doctor in medicine is with the JAK-STAT pathway. So I was able to publish a paper with the pro-inflammatory cytokines and interferon-stimulated gene response induced by influenza strain to a cell line. And then one of my methods here, class, is to inhibit the JAK-STAT pathway. So, paano ba natin maiintindihan ang JAK-STAT pathway? Madali lang, class. Kasi ang JAK-STAT pathway, pag meron ka ng cytokines and your cytokines will bind to your receptor, then the Janus kinase will be activated. So, Janus kinase plus your STAT. Tapos, pag na-activate na to class with your Janus kinase at saka STAT class, is magpuproduce na siya ng metabolic function. So, sir, ano yung mga example ng mga metabolic function natin? So pwedeng possible release of a certain cytokines, like for example, interferon beta, interferon gamma, and then you have your component of your adaptive and component of your innate immunity. Yan. Okay? So, ayun. So, ganito lang kadali yung JAK-STAT pathway class. Okay? So, if you're interested in knowing how the influenza virus regulate the immune system. So you can read my published paper. So this is my dissertation with my doctor in medicine. Number 3, kasi yung diniscuss natin kanina, number 2, ang problema is the Jack. Okay, si Jack ang may problema, class. Sa number 1 natin, ang problema si Gamma chain. Ang second, si Jack. Ang pang third class na problema is kakulangan ng enzyme. Okay? So we have your adenosine deaminase or EDA deficiency. Okay, leading to the phenotype of your TBNK negative phenotype, null TBNK phenotype. So, ibig sabihin, class, wala talaga lahat. Okay, affected. So, bakit kaya affected na si B cell here? Kasi kanina, class, ang affected lang, here if you can observe on the phenotype, si T at saka si NK. Positive si B. Here, class, positive din si B. Kasi, these interleukins or cytokines are directed to your T cell. Okay? And then, yung sa pangatlo naman, class, if you can observe, pag wala ka daw enzyme, class. Okay? So, normally, you have your deoxy, okay, adenosine, to your deoxyinosine. Okay? So, that's the end product. So, with this one, with deoxyinosine, so either you have your production of your uric acid or purine salvage. So your kaya adenosine is a toxic compound. Kaya meron tayong EDA class to convert that one. Kasi kung wala kang EDA class, what will happen? If wala kang EDA or adenosine deaminase enzyme, so meron tayong overaccumulation of your deoxyadenosine. And then your deoxyadenosine will increase this one, and then you have your deoxyadenosine triphosphate, which is lymphotoxic. So, ibig sabihin ng class, affected na si B cell. Okay? Kasi, etong si deoxyadenosine triphosphate, hindi naman siya pwedeng pumili class na T cell lang yung papatayin ko. Diba? Hindi. So, lahat ng lymphocyte, kasi toxic siya, lahat ng lymphocyte, papatayin niya. Okay? So, the toxic metabolites of your purines accumulate in the lymphoid cells and impair the proliferation of both your B and your T cells. Okay? Naintindihan? So, you have 3 mechanism of your seed. Okay? So, you have first, with a mutation on your common gamma chain. Second is there is a problem with your JAK3 or Janus kinase system. And third is the lack of an enzyme, which is your adenosine deaminase. Then let's proceed to your other molecular defects, okay, that is associated with your seed. One, you have your Bear lymphocyte syndrome. Okay, with your Bear lymphocyte syndrome, class, madali lang to. Bakit? Kasi meron siyang defective expression of your human leukocyte antigen. This is a good example, class. With the Bear lymphocyte syndrome, is that your B cell is normal. Here, this is your B cell. However, your APC does not have your HLA2. Okay? Or your B cell also does not possess this one. Okay? Like here, ito na lang pala, class. For example, this one. This is your B cell. And your B cell should present a specific HLA2. Okay, kasi ano siya, diba? Nucleated. However, wala naman siyang class, wala naman siyang HLA2, kaya walang activation na nangyayari. So, yun yung Bear lymphocyte syndrome. Tapos may pa-update, class, kakahabol lang na balita. Okay, so a newly identified molecular defect is a mutation in the gene encoding the common leukocyte protein called your CD45. It is a transmembrane phosphatase, okay, that regulates the signal transduction of your T and your B cell receptor. Yan, so kakapasok lang na balita, class. Ayan, so baka lumabas sa exam or sa assessment ninyo, please take note with your CD45. And we are now done with their seed, okay, which is one of the most complicated disease discussed in our video lecture. So we'll proceed to your WAS. Okay, WAS stand for your Wiskott-Aldrich syndrome. With your Wiskott-Aldrich syndrome naman class, the problem is that there is a mutation of your WASP gene class. Okay, the function of your WASP gene class is for your actin polymerization. That's the reason why if there is a abnormality on your WASP gene, okay, that is found in the region 11 of your chromosome, is a defect of actin polymerization. Okay? Kasi ang function ni WASP class is for actin polymerization naman. Okay? So kung meron tayong problem with the WASP, okay, the problem is mutation to your WASP gene to impaired T cell activation, and then nagkakaroon na tayo ng recurrent bacterial infection, thrombocytopenia, small platelet, and then cytoskeletal defect because of the actin. You can correlate this one in your hematology. Tapos may pneumonics tayo nito class pag Wiskott-Aldrich syndrome. Diba sa board exam, meron tayong pneumonics, water. Okay, W for water, then A for your Aldrich. Tapos, condition yan nga kaagad class. You have your thrombocytopenic, purpura for your T, E for eczema, then recurrent infection naman. Yan, for your R. Okay? So, yun yung mga palatandaan natin sa Wiskott-Aldrich syndrome. Next, you have your AT. Ito yung isa sa mga class. Siguro pag nagbasa kayo ng book, you will try to check why this condition is included in the immunodeficiency diseases. And we will try to discover that one now. So, your ataxia, telangiectasia. Okay, we will try to dissect that one. First, with your ataxia. Okay, ataxia, ibig sabihin, lack and then taxa is for coordination. So there is a lack of coordination. So imbalance class, okay? And then madali kang mahilo, vertigo, also very common. And then with your telangiectasia is this one. So meron tayong opening of your pores. Kaya nagkakaroon tayo ng ganito class. Okay? Reddish butterfly area on the surface. Okay? So although this one is a rare autosomal recessive syndrome characterized by cerebral ataxia and telangiectasias, especially on the earlobe and conjunctiva. Kaso yung example ko class is the butterfly area on the skin. So, ano yung problema with your ataxia or AT class? Okay, what does one class lies on the ATM gene? Okay, ATM is your ataxia, telangiectasia, mutated gene. So, aside from your ATM will have different factors that includes cancer, radiosensitivity, meiotic defect, and of course, you have your telangiectasia. So it has immune dysfunction. So mutation of your TM will lead to immune dysfunction. And then, sir, ano ba ang importance ni ATM pagdating sa immune system? So remember class that your ATM also regulates for the rearrangement of your T cell receptor and immunoglobulin gene. So, ibig sabihin class, pag may problema yung ATM natin, nagkakaproblema din yung rearrangement of our T cell receptor. Okay? And then, your AT, okay, to properly repair your DNA damage lead to accumulation of your mutation, then greater risk of your lymphoid malignancy. Kasi yung ATM naman class, yung isa sa mga powerful activity niya is more on the repair. If kung walang repair class of damages, then nagkakaroon tayo ng accumulation of mutation. Then this will lead to your high risk of your lymphoid malignancy. And now we are done with the cellular level class. So we'll jump off to the last part of this video lecture, which is defect of your neutrophil function. Okay, so defect affecting each of your phagocytosis steps could lead to an increased susceptibility to pyogenic infections. If you can observe class, this one, I don't know if you're familiar with cells at work. This is your lymphocyte, specifically neutrophil kasi may dala-dala siyang class, kutsilyo. Yan. And then, the function of your neutrophil, of course, as described by your Stevens, sila yung class, main effector of your bacterial infection. Aside from they contain your Fc gamma receptor that will bind to the Fc portion of your immunoglobulin G, okay, that opsonize the bacteria for the engulfment. We call that one indirect, diba, phagocytosis. Okay, so with this topic, I want you to recall what we discussed in your phagocytosis. And one best example of your class defect of your neutrophil function is your CGD or chronic granulomatous disease. Okay, this one is the most common and best characterized of the neutrophil abnormalities. And then here, if you will mention with the granulomatous, bakit, like for example, in the lab, maybe they will ask, okay, why they are termed granulomatous. So, because of the formation of your granulomas. And your granulomas is a collection of your immune cells. Bakit? Kasi may failure of the neutrophil is there. Okay, neutrophil can recognize the bacteria. However, the neutrophil, okay, cannot digest it properly. Okay, so nakakain niya, class. Pagkain niya, hindi niya lang talaga siya nadadigest. Okay, so that's the problem. So inability of the patient neutrophil to produce the reactive form of your oxygen necessary for your normal bacterial killing. So allow me to borrow a slide that we used during your phagocytosis video lecture. Okay, so if you can observe class here in the digestion. So pag nakakain na class, there should be a production of your NADP oxidase. Okay? And then you have your NADP to your oxygen radicals. Okay? And then here class, a genetic defect in any of the several components of your NADP oxidase system. So dito class, may problema daw here. So sir, ang ibig sabihin ba nakakain ng organism? Nakakain class. 'Di ba? Nakakain yung organism ng neutrophil kaso hindi nila na-digest. 'Di ba? Bakit hindi nila na-digest? Kasi daw may problema sa NADPH oxidase system. Ang kagandahan din nito class is that the mechanism of your NADPH oxidase system mutation is not well explained or hindi pa nila talaga na elucidate. So it's a good thing for us learner because most probably hindi siya lalabas sa board exam. Okay? And then I will allow your laboratory teachers to discuss the NBT reduction test naman. Okay, which is a test to identify if the patient is suffering from your CGD. Okay, so that's it for the immunodeficiency diseases. I know na it's a lot of things that we need to digest. Okay, slowly and slowly. And then I hope that you learn something from this video lecture. And then the main reason why we need to divide the video lecture into two, so that in the first session you will try to understand, absorb, digest. Okay, and then repeat again with a book and then with a video lecture for the first session, and then this video lecture is intended for your second session, so it will not be too heavy for you, okay, and not too heavy for your brain cells to process. Okay, so I hope that you understand in a little way with the immunodeficiency diseases, and thank you for watching the video lecture, and God bless us. Okay, so thank you class. I hope that may natutunan konti, okay, with the video lecture kasi alam kong mahirap naman siya. Okay? So thank you. Bye-bye. Bye class. Bye-bye.